Welcome back to the Mountain Morning Show. If you watch very often, you know that I often say to you that if you aren't involved in your political system, you have no right to complain. I know somebody who's going to agree with that. Stephen Tryon, author of Accountability Citizenship.
Joe, thanks for having me back on today.
Absolutely. Welcome to the show again. We're talking about something that certainly gets a lot of media as far as how difficult it is to sign up right now, but a little more than that, and certainly nothing to erase a lot of the confusion people have about it, and that would be the Affordable Health Care Act.
That's right. And you know, the exciting thing for me about this morning is, you know, in my book, Accountability Citizenship, I'm scrupulous about staying away from contemporary political issues because I want this book to be accessible to people on the left and on the right. I believe that we've changed the way we market and distribute information today in a way that discourages effective citizenship. And this book is my prescription for how to be an effective citizen in the information age. And I didn't want that tainted by any by my opinions or by anybody's political opinions.
Right.
So I've tried to stay away from contemporary issues in this book. But I am publishing an Accountability Citizenship workbook in June of 2014. And in that book, I'm going to apply the philosophy using my values. And the idea of accountability citizenship, if you can go ahead and go to the first slide, you know, really to be appropriately positive, to be actively engaged with the information, with the information stream that's out there, to be appropriately informed, and then to be appropriately engaged. It's really all about bringing your individual values to the information stream that's out there and to applying those things. In 2014, I'm going to do that with my personal values. It might not be the same as what you might think, but that Accountability Citizenship workbook that's coming out is going to be something new. And this today, right here live, Park City TV, is the first glimpse at what that looks like when you apply the Accountability Citizenship framework using my values, when I apply it to the Affordable Care Act.
I think this is important for a couple of reasons. We now have a media that's very different than it was, you know, 10, 20 years ago, where the media biases are pretty obvious. Yeah. And that can be, you know, for a lot of people, that's, you know, for them it might be terrific. They can kind of follow the media that fits their lifestyle or what they believe. But the bigger part of it as a whole, when we're talking about accountability citizenship, is if you're going to make a judgment, if you haven't already, you know, well, even if you've got a preconceived notion, you should really take into account all of the different parts of the media. Grab your information from reliable sources, get it from unbiased if you can. That's a big part of what we're going to talk about.
Joe, you're exactly right, and it goes to that first part of the model there, being an active consumer of information in government. Right. If you're a passive consumer of information, you're a target for information marketing businesses.
Exactly.
And they're going to sell you what makes you feel good. That's going to alienate you from people who think differently unless you make an active effort to try to understand why those people think that way.
Well, it's what pushes us into these extremes right now, which is really the problem that we have in with our Congress.
It's certainly a big part of the problem. You know, the people on the other side aren't evil. They have good reasons for, in most cases, I guess I should say, they have good reasons for believing what they believe, and we should try to wrap our heads around why somebody thinks differently than we do in order to be an effective citizen.
Well, let's talk about the basics, the basic facts first of all.
So the first thing, you go out there, I go to thomas.gov and I print out things like a summary of the Affordable Care Act and the summary of the Congressional Budget Office estimates of how much that's going to cost us. And that's where I've pulled these basic facts about affordable care. And you know, it's the Patient Protection and Affordable Care Act is its name. You know, the opponents will call it Obamacare. And you know, the interesting thing about that is last week in the Los Angeles Times, there was an editorial that cited a CNBC poll where 44% of Americans opposed Obamacare, but only 37% of Americans opposed the Affordable Care Act. Of course, they're the same thing. So it goes back to the importance of going out and grabbing this information.
The level of confusion there is pretty obvious.
Because of the information, it comes at us fast and furious, and people use a lot of rhetoric, and so it's very easy to get confused about that. The Congressional Budget Office estimates when they pass this bill, that the Congressional Budget Office puts a score on all legislation as it's going through consideration in Congress.
Right.
And they estimated that this was going to cost $624 billion additional dollars during the period 2010 to 2019.
Okay.
They also though, scored some changes in tax codes and some reductions in other federal outlays, and that was a total of $742 billion in either new taxes or in reductions. And so the net estimate by the Congressional Budget Office was that the Affordable Care Act was going to reduce federal deficits by $118 billion over the period from 2010 to 2019. Now that just seems implausible based on the fact that this big new government program, but you can go to thomas.gov, you can look at the document yourself, and you can see that $624 billion in additional outlays offset by $742 billion in new taxes or in reductions of other programs, and that's what gets you to that claim.
The fear here, though, is we always talk about revenue streams. People love to shut off the revenue stream because that's the part for your constituency that they're like, wait a minute, I don't want to pay more for anything. But the truth of it is sometimes we've kind of got to dig in a little bit into that pocket and be willing to put towards the better good.
Well, you're right, Joe, and we've already seen that the problem and the reason why we're in the fiscal crisis that we're in right now in terms of the debt that we have is that we pass a law like this that when we pass it, it looks pretty good on the balance sheet.
Right.
But then we go in subsequent years and we strip out the painful parts, we strip out the taxes. And you're already seeing people talk about delaying or deferring or eliminating the tax on medical devices. Well, that's part of what was designed to offset the cost of that $624 billion.
The devices are probably one of the largest portion of this.
So we have to be careful about that as we go forward. That's the most powerful argument in my mind against the Affordable Care Act, but we'll talk about that a little bit more. If we go to slide 3, I think it's important to sort of look at sort of a summary of what the Affordable Care Act is.
Right.
And at its heart, it's a mandate for most Americans to have health insurance. And we've never been required to have health insurance before. It's always been a personal choice.
And it relies on this because if not for folks who are young and healthy being part of this program, which right now is kind of a little bit of an issue because typically they don't get insured, we have to have them insured to make sure that the program it balances itself.
That's right. We're basically expanding the pool of people who are buying the coverage, and by doing that, you're putting more money into the pool, and that helps lower the cost of the people at the high risk end and that might be denied insurance under the current system because it's more expensive to provide coverage for them.
The interesting part about that, it's like the most basic part of insurance. When you take your insurance exam, which I took mine a couple years ago, the very first thing it talks about is insurance is how insurance happened in the first place. And the history of it was guy going to town with milk, dumps the milk, he loses his entire monthly income. Other farmers help him out to cover the cost.
Right.
They spread it amongst the group. That's insurance.
Right.
And we forget sometimes that it's that simple.
Yeah.
So it does require everybody to be involved.
Yeah, and essentially, like I said, the major tenet is everybody has to be covered under this new law, or most everybody has to be covered. The second big thing is we set up exchanges for people who have been denied health coverage so that they're able to go in and purchase this insurance, and that is another big part of it. And then you've got the taxation on the high end, the current high premium plans, which are probably plans that the wealthier people in our society are buying. They have a higher level of service, but they also have higher premiums. Well, the government's going to tax those now to help fund this affordable care for everybody. And then there's some changes in Medicare and Medicaid as well to help expand coverage and to cover the costs.
Interesting. All right, so that's kind of gives us the basic ideas here. It expands the eligibility of Medicaid, as you mentioned. There is, of course, you said the higher tax. One of the questions I had that kind of comes up with that is we saw Congress, kind of balk on one thing, and that was some sort of a waiver that some people were going to get for not being part of it, as far as congressional members and the White House as well. Are you familiar with that and what that was about?
Yeah, I'm not certain what all that was, to be honest. It struck me as political maneuverings in order to shine a light on Congress and sort of put them under the president and put them under some heat for being treated special.
They've got a pretty good deal. and that's, I'm sure there's some people in Congress that don't want to let go of that.
Well, my friends who work in Congress, and I worked there for several years. That's why I'm so passionate about all this. My friends who work in Congress tell me that the congressional staff and the congressional members have the same policy, the same coverage that other federal workers have. So that's what I hear from my friends. I have not done the research on that personally, but
I'll get back to you on that.
Yeah, we'll cover that a different time. But
Sounds good.
If we go to the fourth slide, Joe, the next thing about accountability citizenship, when you apply the accountability citizenship paradigm to any issue, one of the first steps to having an informed opinion and a well-formed opinion is to acknowledge our personal biases, because we all have them.
Sure we do.
As human beings, we all have them. And I have personal biases relative to the Affordable Care Act. It's based on my experiences. It's based on what I've seen and what I do. I run human resources for Overstock.com. I've helped Overstock set up its healthcare programs over the years and to keep those programs in place and to make them affordable as much as we can for everybody. So I do have opinions about this and biases, and one of them is I know people who've been refused coverage.
Right.
People close to me that have been refused coverage, and these are hardworking people, these are middle-class people, and the effect of being refused coverage, or if they're able to get coverage, being forced into these real expensive plans, it's financially devastating to have to cover your own medical costs or to go into these high-end plans. The median household income, I'm told, in the United States is just north of $50,000 for a household.
Right.
If you look at the average employer-employee mix for a health care plan, you figure the average person out there who's working for somebody and getting health care through their employer probably paying 5 to 7% of that 50 some odd grand towards their health coverage.
Interesting.
If you're refused health care and you got to cover yourself, or if you got to go into one of the, that goes to 14% of the 53, 51 grand, whatever. It goes to 14% almost immediately. So it's financially devastating, and I have to believe, based on my personal experience, that there are a lot of people I don't see in the lower stratas of our economy who just simply can't afford it.
Yeah.
And as a father, as somebody who, fortunately, I've always been able to have good health care for my family, but I remember holding my son when he was sick, even with good health care, and feeling so helpless that I couldn't do anything for him. The thought that we've got whole groups of Americans who don't have access to any health care and are dealing with that with their families is unacceptable to me. So I have
Absolutely.
a bias.
Well, and the truth
bias.
of it is, at the end of the day, I think that we all have to acknowledge that when worse comes to worse, families are gonna pull together other people. We're gonna do it charitably to help people. So the fact is, we're still doing this even if we don't go to a better system. Better to move to something where everybody has a fair shot.
Yeah, and to your point, we all are going to bring our personal values, and some of us have stronger values around our families, and some, the nuclear family is under pressure, I think, over recent decades, and so not everybody has that support system in the same way that others
exactly.
do. But I will tell you that when I look at this, again, I have to acknowledge my personal bias, and then I have to ask myself, what are the values that are most important to me that apply to affordable care? And for me, I think of three. I think of the Constitution right away. I was a soldier for 21 and a half years. I had an oath to support and defend the Constitution. I know you're in the Air Force, and I thank you for your service. And I know you have the same oath to support and defend the Constitution. So the Constitution for me is always where I start. I think of it as a system of procedural justice. It's a system of procedural justice that's intended to ensure fair treatment for all Americans by the systems that sort of comprise our social network, our society. So that's one value. The next thing is fiscal responsibility. I really am fiscally very conservative. I see no reason why we shouldn't be able to balance our budgets unless there's an emergency on the order of World War II or September 11th or something like that. I see no reason why we shouldn't insist on a balanced budget every year. It's just a matter of priorities and choices.
That's right.
So that's the second value that I bring to bear here. And then the third thing is the whole notion of the American dream. And I talk about the American dream a lot in here.
Yeah.
I think I'm the product of it in a very big way. My dad was a poor boy out of upstate New York, enlisted in the Army right out of high school, and based on his actions on the battlefield, he was promoted to the officer ranks, and that gave me opportunities that I otherwise wouldn't have. And so I feel like I'm a part of the American dream. And when I look at America and I look at people across our country, I really believe that the American dream, and by that I mean the ability, the hope that you can make your lives better for yourself and for your family.
Exactly.
By the work that you do today, by the constructive behaviors, by working hard, paying taxes, going to school, you can make your life better and your children's lives better in the future. You know, it's about hope. And so that's another central value of mine. I like to say hope is my drug of choice.
There you go.
And I think we need to rely on that and fund it and take care of it in our society.
Well, let's talk about some of the arguments against affordable health care.
Again, because I have a bias for it, when I'm applying my model, I want to start by trying to understand the arguments against it.
Okay.
And I want to try to be as fair to those arguments as possible. And the most powerful argument, as I mentioned, is that the Affordable Care Act is a hugely expensive government program, and we can't afford another one of those programs. Okay, we can't afford another program that costs more, that's going to increase our deficit over the next 10 years. I don't believe. So I give that one a big green check mark.
Okay.
You know, I think that's the most powerful argument against it. We have to be on guard to make sure that affordable care is affordable for our society as well as for individuals. The second argument that I hear out there is one that actually makes me a little angry, and it's because I think it's misinformation. But you'll hear a lot of people talk about the Affordable Care Act as socialism, that it's the end of the free enterprise system for the American healthcare system. And that's simply false. You know, if you go back to the slide that I presented about what is affordable care,
right.
Socialism is a defined term. We know what it is. A socialized healthcare system is where the government owns all the hospitals and all the doctors work for the government. That is not what the Affordable Care Act does, not even close. The Affordable Care Act sets up exchanges. It relies on the same private insurance companies that are out there now and the same private insurance systems. The same government systems too, Medicare, Medicaid, et cetera, are changed around the edges. But it's not socialism, and it's absolutely irresponsible for people to use that. They use that because it's an emotional hot button, and it gets certain people very, very excited and opposed without really engaging on what are we saying here.
Speaking of the hot buttons, we're running out of time. I want to make sure we touch all of them, so let's go through a couple more and then get to the arguments for. So the one that it's a violation of the Constitution, clearly we've already figured out that that's not the case.
Sure, the Supreme Court's not always right, but the Supreme Court ruled on this and they said that it wasn't a violation of the Constitution.
And we go with that.
And then you'll hear people say that the majority of Americans oppose the Affordable Care Act. I don't believe that's true. Looking at the Gallup poll from 2009 when it was passed, there was a plurality of Americans who supported it at that time, 49% to 40%. When the Supreme Court ruled on it, that narrowed to 45% in favor and 44% opposed. And just in July of 2013, just as we were going into the budget conflict, 57% of Americans support implementation of the Affordable Care Act, which is now public law. Now, and the big concern that they have is that we keep it affordable, that we do it in a fiscally responsible way.
All right. Well, let's talk about the arguments for affordable
Again,
care.
for me, the argument is it is affordable. It's another massive government program, but we can afford it if we make the right choices.
And as long as we keep the things implemented.
Yeah, we got to be disciplined, and we got to hold our members of Congress responsible for being disciplined about it. The second thing, again, defending the American dream, I think it's important for people who don't have access that we give them a fair shot at that. And then the final thing is what the poll numbers that I just cited. In fact, when I do the research, I find that a majority of Americans do support implementation of the Affordable Care Act.
And then we have one last slide which talks about the percentage of GDP.
Yeah.
And it's really, I'm surprised, it's not, when we talked about healthcare as part of GDP, clearly that's where Americans spend their money.
Right, well, you look at that slide. I mean, the red line at the top is the United States. We spend more on healthcare as a percentage of GDP than anybody else in America. Back in 1980, which is the point at the left, we were down there in the pack. And then between 1980 and today, there's been this huge schism, okay? And the people that are making money off of that increased spend in the American economy are the insurance companies, essentially.
Right.
And so, you know, I had an insurance executive, a dear friend of mine, a mentor, who used to say that the way you make money in insurance is by increasing the number of low-risk people who are buying policies, decreasing the number of high-risk people who are covered, and running your programs very, very efficiently. Well, in the Affordable Care Act, basically, we're extending coverage to everybody, not just, we're not excluding
Right.
the
We're
high
headed in
risk
that direction,
people.
which is a
Right.
good thing.
Right.
Well, Stephen, I appreciate you being here and getting through some of this. I wish we had more time to spend on it. I'd like to talk about it more, but we certainly appreciate the research you've done and encourage people to get out there and do it themselves, right?
Remember, if you're not happy with how it's gone, you can
Right.
be a super citizen. 87% of Congress we can replace next November, and I'm advocating getting those incumbents out and getting some fresh heads into Washington to wrestle with these problems.
Thank you so much.
Thanks, Joe.
All right, we'll be back to wrap this show up in just a minute, right after this.